I attended today's event because Ambient Voice Technologies, AVTs, are definitely all the rage in the NHS right now. And so when I heard that there was a great event happening in London with all of the key players in the field coming, I just had to be here to try to hear about what they were saying and what the concerns were around this new technology.
So I attended today's event because Ambient Voice Technologies is becoming a pervasive technology that's being deployed across our healthcare system. In Glasgow and in Scotland, we're very much thinking about how we deploy these, both in primary and secondary care, but critically, how do we create the evidence to support their adoption by being able to demonstrate both their safety, their clinical effectiveness, and equally, potentially their cost effectiveness as well.
With AVTs coming into care, I am excited, of course, because this is fantastic technology addressing a real problem that contributes towards burnout. And I'm excited because people are finally taking technology and pulling it towards them, as opposed to having it pushed that way. But I'm slightly anxious, not about the technology itself, but because this is such an opportunity to get the basic foundation of governance and safety rights that will allow us to access everything else. So my anxiety is about using the opportunity well to get people using the technology safely and comfortably so we can move on.
It's great to be reassured that patients and our staff, our NHS workforce, are really enthusiastic about the potential for ambient voice technologies, but actually reassured that despite the fact we could easily procure them, we do need to be considerate about the implementation. And that's not just about the technical implementation, nor is it just about data security, but it's about all aspects of training, user interface, and that sort of reliance or over-reliance that happens. The outputs that are generated by ambient voice technologies could really save time and reduce the risk, clinical risk for patients if accurate recordings of those clinical consultations are made and in their records contemporaneously, rather than there's a delay. In our health board, it can be up to 3 months before some of those outpatient records are in the patient's notes. But even if we think beyond that, a patient could take home a summary in their language or at their literacy level that would summarize what they need to understand from the consultation, which would be a complete game changer.
So I think for every technology, my baseline is excitement, because I think there's an opportunity to both transform and potentially also disrupt how we deliver care. There are, however, some requirements about us being able to demonstrate safety, to be able to monitor, and I suppose that's why we're working with the Nuisance Tree platform, is to really clearly think about how we can monitor these technologies, provide confidence to both our patients and our clinicians about their safety.
I am both excited and worried about AVTs coming into care. I think I'm more excited about it because I see how much time it could save, how much more patient engagement it could give with the doctor and patient relationship. I also think it creates better and more accurate note-taking. However, we know it's not foolproof, we know people need to check it, and we know there needs to be a governance system in place to make sure that if something goes wrong, that we can pull it or change it as we need. And right now, we don't know that we have those in place, so that's what worries me.
I'm really enthusiastic and excited about the potential. I think it really can help us with accurate documentation that leads to better understanding, less technological barriers between patients and caregivers. But at the end of the day, we need to be, as a community like we are here today in London, talking about the challenges, sharing learning, not operating or establishing in silos, and then giving equity of access to new technologies despite sometimes the organisational fragmentation in the NHS.
So I think the critical thing around about adopting of AI, and in fact any sort of transformation within NHS, is around about trust. We know that actually healthcare moves at the speed of trust, and investigators such as myself, working with industry and academic and NHS partners, are about creating the evidence that allow decision makers, both our patients, our chief executives, and the wider system to trust these technologies through high quality evidence.
I think the one thing that we need to do to increase the use of AI in the NHS is getting people using AI, but not particularly in the NHS. I think AI, more than any technology before it, really benefits from people experimenting with it and understanding what it can and can't do. Now, you clearly can't do that when you're dealing with patient care, because that's a high-risk area. But where you can explore using AI and these commercial models is on things like your hobbies or in your personal world, things that you're excited and interested about that maybe aren't quite as high stakes. You're more likely to use them and try different things. You're more likely to persist, but you're also going to be interested in when it goes wrong. You'll work out what works and doesn't work. You'll learn more, and you will inevitably learn about what it might be to use it inside healthcare. That is the unlock.
Investment in staff. So that means training for all clinical, patient-facing and administrative staff to understand the potential gains and the risk, and also investment in staff who can then take the outputs of monitoring of AI and act appropriately on changes in performance or drift.
The most important thing that we have to do is orchestration. Lots of point solutions, whether they're AI or not, that are not coordinated and not orchestrated could lead to chaos. If you have an orchestration layer, you've got governance, and then you can measure things like drift, you can evaluate. Orchestration is the key to using AI responsibly at scale.